So we are going to go over the common knee injuries that are involved in running, or that you might be dealing with these things and you're trying to return back into running. So I'm going to share my screen now, and we are going to use this anatomy tool. I really love it. It's very helpful for you to be able to see what is really going on and what it looks like on the inside. So we're going to talk about quad and patellar tendon first, and I'm going to kind of zoom in a little bit. Now these things there's a lot of things going on here, but we are going to hone in on the patellar and quad tendon. So those are just bursas that I'm getting rid of right now. And you see the patellar tendon, the ligament right here, and then the quad tendon right there. So a lot of people will deal with patellar tendonitis. That is what you think of when you hear jumper's knee or runner's knee. And that is the ligament that is the tendon that attaches your kneecap to your tibia. So to that longer bone down there, and that attaches to your foot. So when you bend and extend your knee, that is moving your kneecap. Your kneecap is a floating bone other than these two attachments with your patellar tendon and your quad tendon. So we will be loading this tendon when we're strengthening your patellar tendon, because a lot of times the fibers themselves, if we zoom in, they get frayed. So that tendon, that's what tendonitis is. It's fraying of the tendon itself. So you can see how it attaches to the knee and the kneecap. And when those frays happen, you get that signaling and that pain signaling. So we need to tell the body to lay down tissue nice and uniform, like it is right here, where it's straight up and down, to get rid of that pain. And then when it comes to the quad tendon, let me just zoom in again. It is the tendon that attaches your huge quadricep muscle to your kneecap. So a little bit different, as it's a bigger tendon itself, but it does the same thing. Trying to zoom in a little bit more so you can see. So it does the same thing as far as bending and extending your kneecap up and down this groove, but people can get pain on the top of the knee right here like this, and that's usually a quad tendonitis. They're very similar. We will be treating them very similarly, so we're going to be loading that quad tendon, probably with knee extension kind of exercises, knees over toes exercises, but that quad tendon is just a lot bigger than that patellar tendon, and it attaches to the quad, which is 4 different muscle groups that extend your knee. So that is quad tendonitis. We will go over meniscus tears in the next video.